Okay, it's time for the ankle joint.
Going to show you how to scan the anterior ankle joint. So the patient position is supine. Very important to make sure you have the heel hanging off the end of the exam table. The landmark is going to be the distal tibia, and you get that in focus on one side of the screen. You also want to make sure the tibialis anterior tendon is at the top of your screen. And we know that tendon goes from a little bit lateral and curves a little bit medial, so there's a touch of an angulation of the probe. The movements are going to be sliding medial off the tibialis anterior, back onto it, and lateral, and then back onto it, just to make sure you have identified and appreciated the full width of that tibialis anterior. There's also going to be some slight angulations of the probe to make sure that you get both the tibia and the talus nice and bright. The area of interest is going to be the sulcus between the tibia and the talus, where there's some intrasynovial fat.
Okay, it's now time to draw it. So, bone. Well, we know this is our tibia, so there's our tibia there. Our talus is here, so there's our talus. Draw that last one a little bit better. Cartilage. Well, this is the articular cartilage, the hyaline articular cartilage of the talus, and here's the hyaline articular cartilage of the tibia, which you can't see very well. Fluid. Well, we know there's going to be some fluid in here, hugging there, even though it's not like a big black pocket. Ligament. Well, what connects ligament? What connects bone to bone is ligament, so it's going to come down like this. Tendon, well, we know we've talked about the tibialis anterior tendon quite a lot. Do that one more time. We've talked about the tibialis anterior tendon quite a lot. Muscle, there's no muscle in this view, so let's clear this away and do it one more time. So tibia, talus, articular cartilage, fluid, like so, ligament, can't really see it very well, but it's there. Tendon, tibialis anterior, and we've lost it a bit here, but this is essentially the tibialis anterior. Forgive me, let's do that one more time. Tibialis anterior tendon like this, and then there's the top of it, and there's no muscle in view. Okay, well that's it. Let's see what it looks like in a live patient.
Going to show you how to scan and inject the ankle joint. For this, I'll usually have our patients supine with the heel hanging off the table. This opens up the ankle joint. The landmark is going to be the tibialis anterior tendon. I now have that in the view on the top of the screen. The orientation of the probe is long on the tibia, slightly obliquely actually. The ankle joint is where the tibia stops and the talus begins. We'll usually place the center line over the articular cartilage of the talus, keeping that tibialis anterior tendon nice and bright on the top of the screen. We can then place the needle tip medial to the tibialis anterior tendon, going straight down and touching the articular cartilage of the talus gently. That's how I scan and inject the anterior ankle joint.
Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfying.